Okay, welcome. So I came across a headline. I think I saw it a couple of days ago, but I saw it this morning. Uh, again, with a nationwide hamburger recall due to E. coli contamination. And I thought, man, fitting for this chapter today. All right. So I left off starting with some dental stuff. And we went through and talked a little bit about cavities. We want to go through and describe some more details and other players besides Streptococcus mutans that we'll see here in just a second. So more with this, we can see initially the biofilm with the plaque buildup. And if that progresses, we can see tartar building up. So dental calculus, calculus in and of itself is bad news, right? Is what I feel like. Dental calculus, that's trouble. All right. So we can also see the progression of a cavity, tooth decay. I'm assuming we're probably looking at the same tooth as we're moving through here as we go in and remove all of the cavity and then come back in with a filling afterward. We're not seeing the end result, but that's the progression, and you can see some of that with the x-ray as well. So now we can see maybe the same image that we left off with on Monday. The plaque and the potential for the gums to become irritated as a result of the microbes colonizing. So we can see redness and some inflammation. This is evidence of gingivitis. So removing this, seeing the dentist regularly helps to ensure that that's not occurring. So we showed this image of a healthy tooth. Initially, we started this, and now we want to see the progression when stuff goes wrong. So initially with the gingivitis, the redness, this is the first stage in periodontal disease, and left unchecked, we can progress. So we can see the gum line starting to recede. The enamel of the tooth goes under the gum line, and as that gum line recedes, it provides the potential for that thinner layer of enamel to start getting degraded. We see greater erosion of the gum line, and now areas of the tooth that aren't covered in enamel are exposed, and the potential for microbes to get in considerably easier, lending to loosening and potential tooth loss as a result of advanced periodontitis. Skipped over. So next, and we'll see in a table here in just a second, inflamed, eroded gums. This is a mild case of acute necrotizing ulcerative gingivitis, ANUG, sometimes called, Vincent's disease, trench mouth, all of these same idea, and we will see some players with this. Definitely, although it says mild case, this can be really pretty serious occurrence, and we think of advanced periodontitis, ulcerative gingivitis, right? So we've got serious issues at the gum line, and handful of these bacteria, anaerobes that create really some stinky breath as a result of that. Viral stuff are herpes simplex, we could see on the face, but we can also see in the mouth potentially. So this is acute herpetic gingivostomitis. in the back. Looks like maybe a little something going on the tongue as well. Maybe this. Thrush is another way that Candida albicans may manifest. This technically is really pretty common with little kids, just as, you know, their bodies are getting colonized with all sorts of things. Thrush can be kind of common ailment with little kids. This doesn't look like a little kid with multiple fillings that I'm seeing in here. I'm thinking I'm a bit older. So truly depends on circumstances. And this can be something that also sets the stage to show up after or during antimicrobial therapy. Same idea as yeast infections when we're thinking females. Same sort of an idea. All right. So numerous possibilities. Yeasts not fitting with our viral stuff, which we're just thinking initially going through some of the upper part of the GI tract. So parotid swelling is characteristic with a viral infection, mumps, and numerous potentials. We think about droplet transmission and the potential for contracting it that way. So oral bacterial infections. I mentioned mutans, Streptococcus mutans, main player when we think about cavities. There are all sorts of streptococci. All right. So non-transmissible, we think of these as your normal flora. All right. There are definitely circumstances where some individuals aren't harboring mutans. Definitely potentials for people to say, I've never had a cavity in my life. I bet if we were to do some cultivation, we wouldn't be finding any mutants. So just depends on those circumstances, truly. The gingivitis and periodontitis, porphyromonas, streptococcus, and actinomyces are all players for both of these. We saw the herpes. Mumps is a type of paramyxovirus. So all sorts of potentials with this. And through vaccination efforts, we typically think of this as something not truly on the radar, but with anti-vaccination situations, possibility for this definitely is there. And there are some possible serious consequences as the result of being infected with mumps, more than just swelling of the parotid glands. So all sorts of complications with this. It may lend to encephalitis, meningitis, inflammation of testes, ovaries, and breasts. In the instance of the testes and ovaries, this can lend to sterility in these. Typically, it's children that were infected with this in the first place. So later in life, sterile issues for sure. So I mentioned droplet saliva, respiratory droplets from the infected individual sets the stage for that. Candida albicans and some other Candida species are culprits for thrush. And like I said, we can see that elsewhere. Our trench mouth, Prevotella, Fusobacterium, and Treponema vincentii are potentials. And we mentioned Vincent's disease with this. So I mentioned bad breath. Halitosis right there. I have had a few hygienists pipe up and say they know when someone comes into the dentist's office, if they've got Vincent's disease, they know. They can smell it as they open their mouth up to get a cleaning. They know. All right. It every time I'm just like, but what does it smell like? Right? How do you know? What is that characteristic odor? You probably don't want to know. All right, moving onward. we want to think GI tract stuff, we need to think a bit about some foodborne situations as well. And oftentimes, you get a bout of food poisoning. I assume many of us have experienced something like this. And almost always, I feel like the first thing you think of when you're dealing with this is, where did I go out to eat? What did I have for dinner? Right? And you try to blame some restaurant. Maybe that's true. All right. But more likely, it's probably something that's coming from your own house. All right. Uh, Depends on the situation, but oftentimes eating establishments are very cautious with their foodstuffs to ensure that things are kept at the proper temperatures to prevent these situations. And then you flip it around to your house, maybe that's not the case. All right. So we think about freezing or refrigeration temperatures, creating opportunities for microbes to be inhibited, not necessarily killed, but a safer situation. Bumping it over to warmer temperatures, keeping things warm at temperatures out of this danger zone from 40 to 140 Fahrenheit, or between 4 to 60 Celsius. These are areas that we think of as more danger zone, where those microbes have the potential to grow or release toxins, or both, lending to some foodborne illness situations. And there are different ideas with this, different ways that this can happen, where it could be the organism itself causing illness, or it could be those toxins that have been released into the foodstuffs, and that's really what's causing the illness. In those instances, we call out an intoxication because of the toxins, not an infection with the microbes getting in and taking hold. So it's a little bit different dependent upon who we're talking about. So all sorts of different bacteria, all sorts of organisms, more than just bacteria, can cause issues when we're thinking GI. So moving downward, Shigella, shigellosis. There are a handful, E. coli and Salmonella and Shigella, as some main players when we think about some of this foodborne illness. All three of these gram-negative bacteria and the potentials for the disease that we will be manifesting are varied. All right. We can see in this stool sample numerous red cells, white cells, and boatloads of bacteria. All right. Shigella and others. All right. And through different types of cultivation techniques, there's all sorts of types of media that help us. We've looked at a few in the lab, but there are lots more that can help us to distinguish some of these organisms, separating them out like a McConkey's plate, but some others that will also help to differentiate between Salmonella and Shigella, respectively. So here's an image of Salmonella. We've seen this one before, gram negative. This it's trying to get into cells, penetrating in. That's what we're looking at. And we'll go through some details with that in a second. I feel like with this one, I mean, nobody truly wants a serious bout of diarrhea, but deep down, if you want some diarrhea that's going to be the death of you, I recommend you get yourself some cholera. This is bad news. All right. With proper treatment, which is mainly fluid replacement, we can see individuals able to get through it. But without that, it's pretty much going to be a death sentence. Many people died from cholera. We had cholera outbreaks in England that John Snow ultimately traces back to the water pump. Really, it's traced back to the river and all of our excrement getting dumped in there and then brought back into town so you could drink a nice glass of water with cholera in it. Not so good. So we could see multiple situations here with this. The water, where we're using it for doing laundry, bathing, drinking, and waste going into it as well, sets the stage for problems. We think poor sanitation to see issues with cholera potentially skyrocketing. Oftentimes, we see problems after some sort of natural disaster, earthquakes, floods, cholera-like sort of a brackish water, a little bit of saline in there. So coastal areas may be more susceptible to some of these situations. All right. So here we've got an image, clinic in Haiti, handful of cots. My gut says all of these, at least these two, have cholera. You can see a simple bedpan. It's not going to be sufficient. They cut a hole in the cot, the 5-gallon bucket, which I'm assuming is empty right now because you wouldn't want it to be full of your excrement and then laying right on top of it. That's probably not something that's good. All right. That's the bedpan, 5-gallon bucket. All right. And in a single day with a serious bout of this bacterium, you've got the potential to fill that 5-gallon bucket up in one day. 20 liters, it's 5 gallons. That's a huge amount of fluid loss. And if you are losing that much fluid in one day, your potential to die is there. All right. That is serious, massive dehydration, serious concerns. All right. And the toxins cause very watery diarrhea through the release of the cholera toxin that causes these ill effects. Helicobacter, this is an odd bacteria because it wants to live in the stomach, an area that typically we think of as being a sterile area where organisms aren't saying, oh, I'm going to live here. All right. But Helicobacter does. It's got numerous things that lend to its potentials: buffering capacity, the ability to kind of bore into the mucus and then buffer itself so stomach acid isn't an issue to this bacterium. As it erodes through there, stomach acid has the potential to come in contact with the cells, lending to ulceration and potential bleeding ulcers as well. This is a bacterial infection that can be cured. You can cure yourself of these ulcers with antibiotics and some antacids to help alleviate this. For years, these ulcers, people didn't really know what was up. They blamed it on different types of foodstuffs, things that may stimulate excessive acid production, maybe lending to problems, but truly it's not the food that's causing these issues. It's these microbes. Clostridium difficile, this really is a situation where we think about antibiotics that have wiped out a lot of the normal flora, lending to these bacteria proliferating. Clostridium difficile is very antibiotic resistant in and of itself. All right. It's got a lot of potentials to evade numerous types of drugs that we throw at something else. All right. As the normal flora gets depleted, Clostridium, untouched, grows out of proportions, starts releasing toxins that stimulate all sorts of responses, pseudomembranes, sloughing off of skin, lots of pus and infiltrates from immune cells within that, issues with absorption, lots of diarrhea, discomfort, serious situations with that. And treating with some hardcore antibiotics to combat it can potentially cause other problems in the host. So trouble all the way around. This is something that we can describe as a super infection, an infection with organisms that we already are harboring that basically grow out of proportion. Kind of the same sort of an idea as those yeast infections where they're not targeted by those antibiotics and they grow out of proportions. Same sort of an idea. All right. So with some of the bacterial culprits, numerous players here, Bacillus cereus, B cereus. You have likely seen this bacterium in the lab. I feel like probably. You've worked with some of it, Bacillus cereus and Bacillus subtilis, two common bacteria that we work with in the lab. There are potentials for this to cause issues. This is an aerobic bacteria and has the possibility to contaminate foodstuffs. And then dependent upon how it is dealt with, cooked or not, sets the stage for some of these issues. Nausea, pain, abdominal cramps, diarrhea, and vomiting. We think about ingestion of contaminated rice or meat, even after cooking. And rice is a pretty good one for this. The bacteria can create spores that are found on the grains of rice. You cook the rice, you then potentially don't keep it in the proper, warm conditions. It gets brought down to room temperature. The rice is just hanging out, all right? That allows the spores to grow or to germinate, the bacteria to grow, and toxins to be released. So sometimes they call this fried rice syndrome, Bacillus cereus, all right? Other things also possibilities. And again, holding temperatures set the stage for it to maybe not be so good. My oldest senior got a little of this a couple of months back and went to a taco place, got tacos and rice and beans, and left the leftovers in his car, went back to school, came home, brought the stuff in, popped it in the fridge after it had been in the car for hours. And then a couple of days later, he ate it. And the next morning, no school. Done deal. And he's wondering what's up. And I'm like, dude, I bet you it was the rice. I only saw it in the fridge. I didn't know what he did to it before that. I thought he ate it and then brought it, right? Nope. Like, that's a problem, right? He's not a fan of rice right now. Will he ever be? I don't know. Not so good. All right. I feel like that's pretty common. You have something and you throw up. That's kind of off the menu for a bit, maybe for forever, right? I don't know. Campylobacter jejuni, this is one of the main bacteria that we think about pasteurizing milk to prevent gastroenteritis. Serious issues, fever and diarrhea and cramps, vomiting, maybe some dysentery. You can have other complications if you've got some autoimmunity. Unpasteurized milk is the main culprit for this, but we can see it in other situations. Undercooked chicken, who would do that? Accidentally, my gut says. Undercooked chicken or potentially contaminated water that's ultimately been contaminated with fecal material from cows is usually what's happening with that. All right. I went through cholera, severe diarrhea, all right, maybe lending to death. The Clostridium, pseudomembranous colitis, all sorts of ill effects, potential perforation of the bowel, lending to septicemia, shock, and death. Bad news, all right? And like I said, you already have a bit of this Clostridium, so it's an overgrowth. There are other opportunities for hospital-acquired Clostridium and bigger complications with immunosuppression. Another Clostridium perfringens, can cause gastroenteritis. This is also a culprit for gas gangrene. So just different part of your body. Mild cramps and diarrhea, all right, in most, but it can be more severe, can cause intestinal gangrene and death, all right? So undercooked meats are the main culprits for this. E. coli, boatload of different types, strains of E. coli that set the stage for issues. I didn't open up OpenStax to show the table, but there is a table that goes through and describes each of these in a little more detail, and recommend that you look at that because there'll be some test stuff about some of this variation. Put a star by it. All right. Helicobacter for the ulcers, salmonella. There's a couple of different types here. Salmonella, salmonellosis, salmonella enterica. There are a handful of serotypes with this. These are the serotype with our bacteria here are where they've got different abilities for our antibodies to be generated. So we can see some variation with this based off of an immune response. All right. That's the serotype. So enterides is the serotype for salmonellosis. Fever, nausea, vomiting, cramps, diarrhea, and in little kids, infants, it can be a fatal infection. Contaminated food, eggshells, contaminated animals, all have the potential for this, harboring it. Reptiles are a pretty good one for carrying some salmonella. Pet turtles and lizards, you need to wash your hands after you've been handling them because it's likely that you've got some salmonella. We've also seen upticks in salmonellosis with people that are becoming chicken ranchers in their backyards, collecting their own eggs, which are delicious, but you need to be cautious with that. And it says egg shells, but deep down, salmonella can colonize the inside of the egg within the chicken before the shell ever forms around that egg. So not just the shell, but the inside. So eating raw eggs, even if that shell's nice and clean, can still get salmonella to you. All right. Shigella, handful of Shigella dysenteriae, flexneri, boydii, and sunnii are all different species of Shigella that can cause dysentery, cramps and diarrhea, dysentery, and potential other issues, especially with little kids, hemolytic uremic syndrome, where the kidneys through red cell lysis wind up getting destroyed as a result of that, potentially destroyed. So I think fecal oral transmission or contaminated food or water, which again, fecally contaminated, sets the stage for those issues. Staphylococcal food poisoning, intoxication, all right? So Staph aureus on our skin, potentially handling food stuff, bringing the microbe to it, and then not allowing it to be either refrigerated promptly or whatever it is, allows the bacteria to grow and release toxins. So this is a pretty quick onset. The ingestion of the toxin gets you nausea, diarrhea, vomiting, pretty quick, 24 to 48 hours after the first instance of this, and you start to feel better. All right. The rapid onset, 6 to 8 hours after the ingestion of that stuff is usually when you start feeling these ill effects. All right. Most other things take a little more time, but the toxin in this case gets you pretty quickly. All right. Another thing that you can think about as you are dealing with some foodborne situations, you're like, oh, where did I go out to eat? How quickly was it since I ate that stuff? Could it be staph, right? Could it be bacillus? Was it rice? What's going on, right? So ingestion of raw or undercooked meat or dairy products that have been contaminated with this. Dairy products are a good one. Custards, creams, different types of desserts, whipped butter, things like that set the stage for the possibility for it to be there. All right. Another salmonella, typhoid fever, salmonella enterica, typhi or paratyphi, typhoid Mary fits right into this. Aches, headaches, nausea, lethargy, diarrhea, or constipation. Why not both? Potential perforation of the bowel, lending to secondary bacterial infection, septicemia, and maybe death. So fecal oral transmission could potentially be spread by asymptomatic carriers, which that was typhoid Mary. She didn't recognize any ill effects in the first place, but she harbored it. All right. And then Yersinia, not pestis. All right. Yersinia enterocolitica and pseudotuberculosis. Another one that we might think about with milk. Mild diarrhea, abdominal cramps, maybe lending to bacteremia, so it gets into your circulation. So contaminated food or water, fecal oral route is the situation with it. A little bit of some virus, rotaviruses. There are a handful of viral GI issues, some similarities in the symptoms. These round, look like little wheels. You can sort of, with your imagination, sort of see some little spikes on the surface on the capsids. I remember as an undergrad taking a virology course and bombarded with massive amounts of different types of virus. And we get into some of the GI stuff. And I remembered rotaviruses fit within that because I thought Roto-Rooter, right? Roto-Rooter has absolutely nothing to do with rotavirus, all right? But I'm like, poopy, right? Fits. All right. Wheel-shaped rota, all right? So with that, our rotavirus at the bottom, all of these gastroenteritis, astroviruses, norovirus, and rotavirus are three of the main common viral culprits for gastroenteritis. Fevers, headaches, abdominal pain. See that with all of these. Norovirus also gets you some projectile vomiting. That's awesome. All right. Dehydration. This can be self-limiting within a couple of days. It highly contagious. We think direct contact or contaminated food, fomites, inanimate objects that get touched. Norovirus is super common to see in stuff like cruise ships. You take a cruise, you almost guarantee you're going to get some diarrhea. All right. Some of that could be written off as traveler's diarrhea. You get off the boat and go in somewhere and maybe consume something. E. coli is a good one for some traveler's diarrhea. But viral, norovirus, it's very common in those situations. And the fact that you're in closed quarters, banquet style eating, all of this sets the stage for opportunities to be shared. All right, with the rotavirus, little kids and elderly are more susceptible to rotavirus. Again, fecal oral contamination for transmission. Okay, shifting over to some more virus. Now we want to think liver stuff. Hepatitis. There are a handful of different types of hepatitis viruses, varied in their morphologies and truly in the manifestation of the disease. You can also see variation within the genomes. I'm not going to go through that stuff. All right. So with hepatitis, we see issues with the hepatic system, as the name should imply, with the liver, inflammation of the liver, potential for numerous complications with the liver. We'll hit a bit of that. Oftentimes, we can maybe first recognition of issues might be jaundice. So yellowing of the skin or the sclera, characteristic of this. So your liver's producing bilirubin that should be getting broken down, helping for digestion, and it accumulates, and that lends to the jaundicing of the skin. So red flag sums up with your liver. all right? It doesn't necessarily mean any of our virus that could be causing hepatitis. You can get jaundice from other liver complications as well, but it's definitely something that is considered rapidly, and you maybe hope that you rule that out. There's numerous ways that hepatitis can be contracted. Initially are A and E, we think of as fecal oral transmission, contaminated food or water, setting the stage for contracting it. The ones in the middle, B, C, and D, we think about bodily fluid. All right. Blood, semen, saliva, all potentials for this to be transmitted that way. So just depends on the circumstances and manifestations with some of the symptomology that you see depends on the type of virus. So with A, this is something that's maybe an asymptomatic situation, which sets the stage like typhoid Mary for it to be transmitted to unknowing individuals, or maybe it's not asymptomatic. It could be mild or self-limiting, a couple of weeks, maybe a month, and in chronic situations, there can be some serious issues with the liver. All right. We'll move down to E, still fecal oral. All right. Also asymptomatic, mild or self-limiting, typically not a chronic situation. So fecal oral, undercooked meats, and it is more common to see in developing countries for that. All right. All right. The blood ones. B, C, and D. With hepatitis B, it's similar as far as symptoms go to A, but we can progress to cirrhosis. It's also associated with liver cancer. I already mentioned potentials for transmission. It can also be transmitted through IV drug use, sexually transmitted, healthcare workers potentially at risk, and there are vaccination efforts, and I believe healthcare workers vaccinated against B, hopefully vaccinated. Hepatitis C, another one where we think a lot asymptomatic, 75 to 85% chronic carriers of hepatitis C. It does have the potential to lend to cirrhosis, liver failure, and is also associated with liver cancer. Another, bodily fluid, IV drug use, transfusions, and sexual transmission, all potentials with that. There are numerous potentials for treatment with hepatitis C and possibilities of ridding yourself of this. Currently, no vaccine for it. Hepatitis D is a little bit odd. All right. It's similar to B, usually self-limiting, and can potentially become chronic. All right. Same idea, blood borne, but the deal is D only is functional if you are also infected with B. If you are not infected with hepatitis B, you don't see any of these issues. It's not active. All right. Kind of crazy. All right. All right. Handful of others as we move through here that I'm like, oh man, I want to talk about these all day. Cryptosporidium, there are handfuls of organisms that will stain up kind of beautifully. Here we can see our Cryptosporidium with this immunofluorescence staining. Cyclospora cadiensis, another one, this one autofluorescing with UV light. I've got so many things to say about these. I'm going to wait till we get to some of this. So many parasites that protozoal parasites that target GI tract. There are others. We'll move into blood stuff. There are other body sites, but GI, there are numerous opportunities. And I'll show you some worms in a second. All right. Uh, Amoebiasis, amoebic dysentery. There is one amoeba called Entamoeba histolytica that is our culprit for amoebic dysentery. And it has the potential to cause some serious issues if it perforates the bowel and starts to migrate. Oftentimes it stays within the intestines. All right. So mild diarrhea to severe dysentery may lend to colitis. If it perforates the bowel, typically the first place it goes is to the liver. When we see liver abscesses, it potentially feeds within the liver and then perforates the diaphragm and migrates into the lungs. If it makes its way through the diaphragm and into the lungs, if we get a pulmonary infection with this amoeba, by the time it's done that, you're on your deathbed, all right? A mechanism to truly treat the host at that point, pretty much not there, all right? Your liver is an organ that can regenerate very rapidly, and infections with this, oftentimes the abscess liver, lobes of the liver are removed, and you're treated with antiparasitical drugs and your liver regenerates. All right. But if we have progressed past that, bad news. All right. So fecal oral route, the cysts of the amoeba are what gets ingested. Once it moves through the stomach into the intestine, it's stimulated to hatch out. The amoeba starts growing and replicating and potentially causing serious issues. Another one that we think about, traveling, setting the stage for maybe contracting it. It is seen in some southern parts of the US, but oftentimes traveling abroad. Cryptosporidiosis, Cryptosporidium parvum, and hominis are the two. Diarrhea, watery diarrhea, nausea, vomiting, cramps, fever, all sorts of possibilities with this. We think about coming in contact with feces from numerous animals, mice, birds, farm animals, a zoonotic sort of situation. We also have opportunities through contaminated food or water, and swimming pools set the stage for problems with this. Little kids are supposed to wear a swim diaper because you just never know. You hope that diaper contains it, but sometimes it's not effective. All right. You can go to a swimming pool where it's got the little kiddie pool type of deal, the splash pool for them. And oftentimes you hear the bell ring or whatever it is, and everybody clears that out. Why? Turd in the pool, right? Guaranteed. All right. And they clear that out. Is that why it's so heavily chlorinated? Probably, right? But still issues, all right? And you can definitely contract it through those situations, all right? Cyclospora catiensis. Oh man, I love this one. Explosive diarrhea, like the projectile vomiting, right? Serious, all right? Fever, nausea, vomiting, and cramps. You've lost your appetite because I've got explosive diarrhea. Damn it, I don't want to eat. Fatigue and bloating. We think about contaminated food or water, setting the stage for this. One of the early recognitions of this was in the 1990s with a handful of doctors in California that got super sick, and they couldn't figure out what was going on. They did a little epidemiology on their own, trying to trace through, and figured out that there was a conference or a meeting that they all went to, a dinner party, and they started going through the menu, trying to figure out what's the commonality. And as it turned out, it was their desserts, some sort of raspberry tort that got them all ill. Raspberries, lots of things that are fragile fruits or berries. may get picked, packed, and shipped to the store and never washed. Because once you wash a raspberry, it starts to kind of get a little bit mushy. And the situation is there. There are always individuals that buy these raspberries and eat half of them before they even get home from the supermarket. Did you wash them? Of course you didn't, right? Did you think somebody else washed them? I think you probably did, but they didn't, all right? Depends on where these things are grown. If they are grown south of the border, there are potentials for contamination with this parasite onto these crops. And in the early spring months, there are some seasonal floodings that potentially sets the stage for human excrement to get washed over these crops, picked, packed, and shipped to you. All right. And that's ultimately what happened. So things like that, other things that we may not think about cooking. Basil is another potential, other herbs as well, but something like that where you pick your basil or you get your basil from the store and you make yourself a pesto. You don't cook that stuff, right? You just blend it up, all right? That's been a potential as well, all right? Awesome. Giardiasis giardia is one of my favorites. Giardia lamblia is what we call it in here. Microbiology courses, it's always lamblia. Giardia has had numerous names, numerous name changes. Giardia lamblia is accepted across the board, but deep down, Giardia is Giardia duodenalis. That's its name. Giardia intestinalis, duodenalis, and lamblia, all the exact same thing. All right. And used interchangeably. All right. In my parasitology course, it's duodenalis because the parasitology book's on it. All right. You'd think the micro book would switch it up, right? New edition. All right. This is a great one for, I feel like, as far as parasites go, protozoal parasites, this organism is almost ubiquitous. You can find it all over the place, all right? Probably not Antarctica yet, but all over the place. We think about freshwater, hiking, camping, backpacking sorts of situations put you at risk if you happen to drink some of this water without boiling it or using filtration devices. The stage is set to get ill. All right. And typically with this parasite, it takes about a month after you have ingested this water for these parasites to get in, to start replicating and taking up as much surface area within the intestines as they possibly can. Then you get the ill effects. At that point, you probably don't even remember the camping trip where you drank the water right out of the stream. All right. You don't have to just drink it. People put their beverages in there to get them nice and chilled. I've seen people putting watermelon in the stream, get it nice and cool, and then slice it up and eat it. Cutting through that potentially contaminates it with the cysts. The cysts could be on the top of your beverages, whatever it might be. You take Fido camping, because why would you not? You take your dog camping, your dog can contract Giardia, and it can bring it back to the house, to the water dish, to your toddler that maybe you didn't take camping, right? That later contracts Giardia because little kids play in the dog dish, all right? They do, all right? Oh, worms. Love it. I should have been on top of it and brought my worm in for you. I've got a humongous test tube with some ascaris, with one ascaris in there. It's about that long, all right? Pretty impressive, all right? About a foot long, all right? These are a type of roundworm, nematode, Ascaris lumbricoides, and a serious, what we would call worm burden. A massive load of these worms can cause intestinal blockages and potential fatal occurrence. Here's some worms that have been collected from a child after some antihelminthic drugs, and the eggs from this worm that are what's infective. So contaminative issues, ingestion of these eggs, they do not replicate and create more worms within you. They reproduce and they release the eggs out. But you see a handful of worms like this, it's not the result of eating one of these eggs. And now all of a sudden you got a boatload of worms. All right. Boatload, buttload. All right. You've got all of these worms as the result of eating all of these eggs. All right. That makes it a bit disturbing. All right. And you can see serious effects with that. Oh man, so close. I'm going to bust this out real fast. I've got like 1 minute. 1 minute? Maybe. All right. Ankylostoma. These are types of hookworms. Ankylostoma canum is one that wants to infect dogs, not people. It can infect us, but it can't migrate through our tissues into the intestines where they'd really like to be. So they stay in the skin, localized, and we call this cutaneous larva migrans, red inflammation as a result of that worm trying to complete its life cycle, trying to get into the intestines, but it can't. Other hookworms, Nicator americanus and Ankylostoma duodenale are the two hookworms that get us. That was the guy walking through all of the crap in the video I showed. That's what he was contracting. Penetrating into the skin, migrating into the circulation, making their way to the lungs, hacked up in the lung into the sputum, swallowed down to the intestines where they want to go. That's what they need to do. That seems disturbing. All right. And then they start growing, releasing eggs. The eggs hatch, larval stage penetrates through the skin, and the life cycle is completed. Enterobius vermicularis is the pinworm or seat worm. We've mentioned this early on, I believe, in the semester. This a highly contagious situation. The eggs of these roundworms are contaminative, spread all over the place. Fecal oral transmission, ingestion of the eggs sets the stage for these problems. Trichuris tricura is the whipworm, another nematode, and potential for rectal prolapse. I'm going to get off of that slide. Couple of other worms, Trichinella spiralis, pork roundworm, gets into the muscle cells, which we would be consuming through poorly cooked meats. And then you get the adult worm within your intestines. Pigs and people, there are some close similarities, and pork tapeworms and pork roundworms, we have opportunities to harbor this juvenile stage as well. Through ingestion of the egg, we can serve as that intermediary host. We're acting like the pig, and it can insist in our musculature or in our brain. In either circumstance, bad news. All right. Other tapeworms or other worms, we don't serve as definitive and intermediary, just definitive hosts, the adult worm. So that's our spiralis. Tapeworms, this is pork tapeworm, Taenia solium. Taenia saginata looks very similar, but up at the top, it doesn't have these hooks, a little bit different morphology. Ultimately, same idea, eating poorly cooked meat. You get the parasite, the larval stage that's encysted in the musculature, and the adult stage within our intestines. We release out the eggs or fragments of the worm called proglottids. Those eggs get ingested by an animal, insist in the musculature, and the cycle is completed after that. I know I'm about done. The flukes, handful of different types of flukes, liver flukes, intestinal flukes, and some blood flukes as well. These are a flatworm like our tapeworm, but morphologically different, right? We call these trematodes and these cestodes, tapeworms and another flatworm, all right, but different. Both tapeworm and fluke are hermaphroditic, so they have both sex organs. It only takes one, and they release their eggs And there you go. And again, they're not replicating in you. The eggs are released out to the environment. So tables go through all of those details. I would love to spout off multiple things with this, but I will not. All right, we will wrap up the rest of this Friday. Farewell. I'm going to have to kick it into high gear, but I will. We'll get through here. Thank you. Sorry I went a little long. It looks as if Meldrum is not in here today.